Thank you, Mr Speaker. This government takes very seriously the challenges faced by women when getting a diagnosis for endometriosis and living with the symptoms, and that is why it will be a priority area in the Women's Health Strategy. I thank my honourable friend, and she raises the case of her constituent, which unfortunately is only too common. We know that the average wait time for a diagnosis is around 8 years. Unfortunately, NICE guidelines published suggest how women should be diagnosed and the treatment they should receive. They're not mandatory, but in the Women's Health Strategy, we'll be strongly urging that they are followed. I thank her for her question. She has campaigned very hard on the issue around IVF. I can say that IVF will be in the Women's Health Strategy. There is IVF services are commissioned at a local level, but there is disparity between how they're commissioned in local areas, and we want to see a consistency of service offered to women and partners. I thank my right honourable friend. I can reassure her that the Women's Health Ambassador, who will be key in driving forward change, not just about raising awareness and confidence of women in coming forward for help, but also improving the services that women receive. And she will only have to wait days rather than weeks before we'll be able to release the name. Thank you. The Women's Health Strategy, as I've said in answer to many of the previous questions, will be forthcoming. We had over 100,000 responses to our call for evidence. We published the vision document in December, and shortly the full strategy will be published. I thank him for his question. It is true that the backlog caused by COVID is having an impact on gynae procedures. The rollout of our community diagnostic centres will help significantly with that, where GPs will be able to refer straight to those, and women will be able to get some of their gynae procedures done in those without having to have secondary care referrals, and we hope that will make an improvement to women. Can reassure the Honourable Lady that Her Majesty's Prisons and Probation Service is already working with NHS England to improve the treatment and support available to women in the prison service, including menopausal women, as part of the National Women's Prison Health and Social Care Review. I thank the co-chair of the Menopause Task Force. We did discuss this in our task force meeting yesterday, and we've agreed to invite ministers from the Justice team to work on this particular issue. The Secretary of State is sitting beside me, and I'm sure he's heard your words.